Welcome to the Kansas Junior Livestock Show Lead Challenge. My name is Brittany Grother, and I serve as the Lead Challenge Competition Coordinator. Thank you for joining us for our third Listen and Learn session. Before we get started, I have a couple of housekeeping items to go over. First of all, this Zoom is a webinar. This means that you can hear and see the presenters, but they cannot hear or see you. Therefore, if you would like to ask a question, please use the chat feature located at the bottom of your screen. You can submit a question at any point during the session, and our presenter will do their best to answer your question at the end. Secondly, make sure to fill out the participation survey after each session to receive your participation points. The participation survey will ask for your name, your age division, and one question about what you learned during the session. The survey links are located on the Kansas Junior Livestock Show website. Today's session is titled From Farm to Fork, Why Responsible Animal Care Matters. Our presenter tonight is Kansas Deputy Animal Health Commissioner, Dr. Andy Hawkins. I will now turn it over to Dr. Hawkins to introduce himself and tell us why responsible animal care matters.
Hey, good evening, everyone, and thanks, Brittany, for that introduction. And my name is Andy Hawkins, and as Brittany said, I currently serve as the Deputy Animal Health Commissioner, and I work at the Kansas Department of Ag. We're based in Manhattan, Kansas. So we'll go ahead and get started. We'll kind of go over our objectives for this evening, and these are kind of the 5 things that we're going to talk about. So quality assurance and proper livestock care, just a basic understanding of what a drug label is, the routes of administration and needle selection, understanding withdrawal times, and then we'll kind of tie that all into livestock show drug testing. As you guys are very familiar with, there are numerous types of medications out there on the market, and there's different types and reasonings and uses for all of these, whether we're talking about an implant or a steroid or a dewormer or an antibiotic, an anti-inflammatory drug such as like Banamine, or even a vaccine. So there's all sorts of different medications out there on the market. When we start talking about specifically quality assurance, so it all starts with proper restraint. So making sure that the animal that's getting the medication or getting an injection or whatnot is properly restrained. And most generally that's done in a squeeze chute, and that's for the safety of yourself, the safety of those people around you, as well as for the safety of the animal. So it all begins with proper restraint. From there, we're going to talk a little bit about administration routes, and there's different ways that we can give antibiotics or different types of medication, and it's either going to go intramuscular or IM, and that just means in the muscle, subcutaneous or under the skin, sub-Q is a common name there, IV or intravenous, and that's a medication that's given in the vein. Most generally, it's in the jugular vein. Intranasal, especially when we start talking about some of our vaccines, might go intranasal or up the nose. Oral, so any medication that's going by mouth, and then also transdermal, something that's actually going to be absorbed topically is what we also refer to that to. You put it on the skin, it's absorbed through the body. It's important to also remember about our injection locations, and where the circle is on this slide, that's the ideal spot to give a medication, especially when we're talking about an IM, intramuscular, or a sub-Q injection. That's probably the least consequence to the animal, and also doesn't have any as much negative impact on the muscling or what would actually enter the food supply at some point. We also try not to ever inject more than 10 mils or 10 cc's per injection site. Needle selection is very important. And when we talk needle selection, the size of the needle is ultimately determined on the size of the animal. So if we're thinking about a small goat versus a large 1,500-pound steer, the type of needle we're going to choose is going to be different. And the diameter is critical. So, and that can also be, comes to play with about the medication itself, how viscous it is, or how more like syrup versus water. Okay, so if you're trying to get syrup through a needle, and need a bigger needle versus water, we can go through a smaller diameter needle, and that's called the gauge. And the larger the number, the smaller the gauge, if you will. So it's kind of backwards from the way that we would think. But a 14 gauge needle is a lot larger in diameter than a 25 gauge needle. And then we also Want to make sure that that needle is of size and diameter so that it's not going to bend or break. And it's also going to be able to penetrate through a hide, especially when we start thinking about a large steer. And then we're also going to consider the length of that needle. And if we're typically doing an intramuscular injection, we're probably going to be about an inch long. So that's a needle that's actually going to be able to get in and actually make contact with the muscle where it's going to deposit the medication, versus a sub-Q needle, which can only be about half an inch or 3/4 of an inch in length, just to go barely under the skin. By and large, most of our food animals, we're going to be in the 18 to 16 gauge range with our needles. And again, if it's sub-Q, probably going to go a half inch or 3/4 inch. If it's an IM injection, we're going to go ahead and go about an inch or thereabouts. It's very, very important that you never use a bent or damaged needle. So once a needle has been bent, do never try to straighten that needle back out, because that needle is very prone to breaking. And if we ever have a needle break off in an animal, it's extremely important that you get your veterinarian to help you locate that needle and get it out of the animal, because we absolutely cannot have that enter the food supply. We'll talk a little drug label information. So what's on a drug label? And just trying to keep it fairly simple here, but just some medication names. So what type of medication we're going to be using? What's the purpose of that medication? So are we treating a respiratory disease? Are we using that as an anti-inflammatory? Are we using it for pain medication? Or is it maybe a vaccine? And what type of viruses are we trying to prevent? And then obviously the dose, how much are we going to give? And then we're back to route of administration. Does that medication go intramuscular, sub-Q, oral, withdrawal time? And we'll go into just a little bit more detail about that here shortly. And then also whether that medication requires a prescription from a veterinarian, or is it something that's available over the counter? And right now, LA200 or oxytetracyclines are something that's still available over the counter, as well as penicillin. There is some indication at some point those may not be available without a prescription from your veterinarian. All right, so we're gonna just do an example here. Here's a product, Nuflor. And you can see the name of the product, and it says right there for intramuscular subcutaneous use, and then also goes into detail as far as what that's for. So basically for BRD or pneumonia, and then also foot rot. And this one here, the next, and this is the same label, just kind of broke down so we can get it on the PowerPoints. It talks about the different doses. So how much are we actually going to give? And it's got two routes. You can either go sub-Q or intramuscular. And then the dose is actually going to vary. So if we're going to go in the muscle, we're going to go 3 mils per hundredweight, as opposed to sub-Q where we're going 6 mils per hundredweight. But if we go into the muscle, we're actually going to follow that up with a second shot in 48 hours. So these are all things that we've got to consider when we start giving the medication. And then we start talking about the residue avoidance. So withdrawal time. So what does withdrawal time actually mean to you? So withdrawal time is the amount of time that it takes for the drug to actually get down to an effective and be metabolized down and absorbed into the system and eliminated or excreted from the body to the point where it's at a safe level to enter the food supply. And that doesn't necessarily mean that it's completely out of the system, but it means that it's at a safe level. And that's been heavily researched through the FDA, and they know exactly what those are. And all medications have to achieve a withdrawal time or document a withdrawal time before they go onto the market. And it's critical that the withdrawal time is definitely or directly correlated to the dose and the route and the injection site and how it was administered. So when we think back to our example using Nuflor, we talked about whether we went intramuscular, so in the muscle, or subcutaneous. And if you remember, intramuscular injection was actually 3 mils and subcutaneous was 6 mils. And we think about that intramuscular injection going deep into the muscle, it's going to be absorbed much readily, much more quicker. It's presented to the body quicker. So it's the withdrawal time on an intramuscular injection for that particular product is 28 days versus a sub-Q injection. We're going to go ahead and have it 38 days because it's going to take a little bit longer to get into the bloodstream, being set underneath the skin. All right, so livestock show integrity and just drug testing in general. And why is drug testing done at stock shows or livestock shows? Obviously, the first thing is food safety, and we want to make sure that we're making sure that we're not having animals that are entering the food supply or the food chain that have any antibiotic residue left, something that potentially could harm someone. A good example of that would be penicillin. If somebody had an allergy to penicillin was to consume meat that still had penicillin in it or penicillin residue, I mean, that could be a very, very dire situation. I also want to just make sure that we're fostering a fair competition, making sure that it's an even playing field for everybody and all the animals. And then just promoting animal welfare, which is something that we all need to play a part in. This is just kind of the protocol as far as what happens at livestock shows whenever we're actually doing the drug testing. We talk about the sample collection, and basically we can either collect blood, urine, or hair. And most generally, we can collect all three of those samples on all species. But for the most part, most livestock shows are going to collect blood on the goats and the sheep and the cattle, and then urine on pigs. And occasionally they may elect to collect hair on the sheep and goats. And it's kind of up to the discretion of the show and discretion of the show committee as far as what they ultimately choose to collect. The sample integrity and chain of custody. Anytime a drug sample is, or a blood sample or a urine sample is collected as part of a drug test, that sample is put into a container, whether that is one of the blood tubes up top or the urine there at the bottom, and that sample is identified. A lot of times we'll use a barcode to identify that sample. And then you also see the red tape. There will be red tape over the top of that to make sure that the integrity of that sample is maintained all the way to the lab so that nothing has opened that up or added anything to that container. With that, there's also a chain of custody form that follows that shipment. Basically, everybody who has access or who has moved that sample from point A to point B signs a chain of custody, and that's just part of evidence to just make sure, again, we're maintaining the integrity. A lot of people want to know, what is it they're actually testing for whenever they do a drug test? And quite frankly, it's a lot of substances, and there's over 300 plus substances that they can screen for. So it's pretty much, you name it, they're going to be able to test for it. But when we get right down to it, there's two classes. There's antibiotics and then the non-antibiotics. With the antibiotics, we're looking at more food safety concerns. So again, wanting to make sure that we're not putting antibiotic residue into the food supply or entering the food chain. And then on the non-antibiotic side, we're looking more at anti-inflammatories, and that would be something like Banamine or flunixin, a medication that makes an animal perhaps was lame and now is able to walk, a diuretic. That would be an example would be furosemide. So medication that they're going to give an animal to potentially to lose weight so it hits into a different class bracket. Basically, it's like a water pill to make them urinate. Anesthetics, and that can be a couple different ideas there, but it's potentially doing a nerve block or something like that. If you had an animal that was having difficulty walking or limping, they could potentially block the nerve so it doesn't feel its legs, so it's not painful. Tranquilizing, acepromazine is probably a really good example of that. If you got an animal that's acting a little frisky or whatnot, and somebody elects to give it some just a tranquilizer to kind of calm it down. Stimulants, caffeine, and for some people will elect to give animals caffeine, and then just kind of on from there. So there's lots of different ideas behind that. Basically, the way it's seen is that they're basically getting an unfair competitive advantage, and that's what they're checking for. And it's anything that alters the physical appearance of the animal, so making the animal something that it's not, that animal or performance enhancement, something to make that animal achieve at a higher level. And then ultimately, we also have got food safety concerns with this one as well. So both of them, food safety for sure. A lot of stock shows that you go to, if you are ever subject to drug testing, will have a form, something similar to this. And I pulled up the one that the KGLS uses, and this just kind of gives you an idea of what's collected at the time of the drug pool or the blood pool for the drug testing. They're going to obviously get the exhibitor's name, detail exactly what they won, what class it was in, get the official ID of the animal. Want to make sure that we've got that correct and make sure we've got the correct animal. And then from there, the first box kind of indicates, is the animal free of medication? Yes or no. And it's fairly simple, yes or no. So that's the first box. And then the next level, just making sure that has not been adulterated or tampered with in any way. So they haven't done something to that animal, whether it's injecting a substance into that animal to make it look more full or those types of things. So that's kind of the next level there. If the exhibitor declares that medication has been given, there is a treatment record here on the back where they'll actually indicate what medication they gave, the route of administration, and then the dose, and then the treatment date, and then what point that withdrawal time is achieved. And that goes right back to why it's so important to know about the withdrawal times to make sure that that's a medication that's, not that animal is no longer carrying that medication, especially an animal that's destined for the food supply or the food chain. And then once the sample is collected, the collector, so whoever is the veterinarian collecting the sample, signs. Usually there's a witness that signs, and then the parent and the exhibitor also sign as well. And everybody just confirms that the barcodes match, confirms that all the blanks are completed, and that's pretty much the sample process. The sheet does stay with the samples. It does not go to the lab, so it usually stays with the show before the samples are sent to the lab. All right, so some considerations here. So we've got zero tolerance versus withdrawal time. Zero tolerance, basically that's based on elimination period. So that means that if the animal's checked for a drug, there's absolutely no drug left in that animal's system, okay? And the thing there to keep in mind is that we can be in a situation where a withdrawal time is achieved, but the elimination period has not. And a classic example is a steroid called dexamethasone. So that's a steroid that some people could give potentially for a performance enhancing drug. And the withdrawal time is 0, but based on calculations, the elimination time could be up to 9 days. So that's those are things that have all got to be in consideration, because that would definitely be considered a performance enhancing drug, because it would make the animal feel better at the point of showtime. Maybe that animal will take on more fill, take on more water, those types of things. So there's zero tolerance versus withdrawal time. And again, this just really highlights the fact that it's important to make sure that you fill out your sheet right. It's very important that you work with your veterinarian to know what medications you're giving and what the consequences of those medications are. And then especially if we have a medication that's not approved for use in livestock, any residue, any value whatsoever shown up on a drug test would be very highly consequential. So just 2 considerations there to keep in mind. All right, and then also we'll just highlight that a lot of times people do not realize that topical medications can be absorbed systemically and result in positive drug tests. So what that means is any medication that you put on your animal can get into the blood system, and whenever they pull a blood sample, they can actually find that at the lab. And a classic example of that is any type of a topical cream that is considered an anti-inflammatory cream that potentially has a corticosteroid in it. And I think you guys kind of remember back to the Kentucky Derby this year, and that's a classic example. So be very, very cautious when you guys are treating anything topically on your sheep or goats or cattle, anything like that. You be very, very cautious and make sure that you're putting a medication on that does not have a steroid in it. So something to definitely keep in mind. Animal welfare. Just want to touch back on this one just a little bit. Sometimes it's really, we're in a bad spot. So we've spent the last, 3, 4, 5, 6 months preparing for the show, and we're dealt a hard blow because we get to the show and our animals got a sore or got a bad leg or foot rot or whatever has happened. And we're kind of at a crossroads that we have to make a decision whether we treat the animal knowing that we may ultimately be disqualified because it's considered performance enhancing, or we don't treat and try to show. And I think that it's okay to sometimes just understand that it's okay to err on the side of animal welfare, treat the animal, and do what's right. So put that out there. Ultimately, those decisions are usually left up to the show committees on a case-by-case basis, but sometimes it's okay to do the right thing. So just want to highlight that. The laboratory analysis has gotten extremely sensitive, and this is something to be aware of as well. And this goes back to the topical medication. The ability at the lab has gotten to the point where they can literally pick up a drop in an Olympic-sized swimming pool. That's how sensitive the tests are. So again, just keep that in mind. It's very, very sensitive. And just kind of in conclusion here, each of us are working here and representing one of the greatest industries in the state. It's the #1 industry in the state. It's something we can all be very, very proud of. So definitely, we're all out there doing the right thing. And I just encourage you guys to work with your veterinarian. Your veterinarian's there to help, be a resource, be a subject matter expert, and assist as needed. So with that, I'll sure take any questions if we have any.
Andy, one came in during your talk. Quinn asked, does caffeine make your animal sick?
To my knowledge, caffeine does not necessarily make your animal sick, but there is some thought that it could potentially be considered performance enhancing. But I'm not aware that it would necessarily make your animal sick. Now, anytime we talk about a toxicity or something like that, we also have to consider how much. So it's a little bit dose dependent. I guess if you gave a lot of caffeine and what type of caffeine you administered, perhaps you could make an argument that it could, but I don't know that it would be something that would necessarily make them sick.
Okay. Another question is, why don't we collect blood from pigs? Why do we use urine for their tests?
Yes, and we can actually collect urine and blood for all the animals if we want to. And the reason is that on the pigs, it is difficult to get a blood sample from a pig, and usually that requires a hog snare, and we would have to use a fairly long needle because you go in through the neck and deep into the chest cavity to actually collect that sample. So given the optics and being at the fair, a lot of times it's just easier just to collect the urine sample. And the fact of the matter is the urine sample is probably our better sample anyways, because the drug residue will hang out a little bit longer there. And that's probably our ideal sample for trying to find residue. Back to the goats and the sheep and the cattle side of things, the reason the blood usually goes there is just because it's a timing issue. And a lot of times it may take a while before they decide to urinate. So just a manpower and timing issue, but there will be some shows that will require both samples collected on all animals. And that's at their discretion.
Okay. There's another question that asks, why are you not allowed to show if you're treating it?
Okay, so and it depends on what we're talking about too. And that's where we kind of, there's lots of scenarios out there. So if it's a breeding animal, there's some case that could be made that animal is a breeding animal, needed some antibiotics. I'm working under a veterinarian. It's considered non-contagious, because that's the other thing we want to make sure it's not something that we're bringing into the show that can be contagious. So potentially we can make an argument that animal could receive treatment. Whereas if it's an animal that is presenting at a show that ultimately is a terminal show where those animals are going to be slaughtered, let's say the show is on a Friday, Saturday, and those animals are going to be slaughtered on Monday and basically enter the food chain, and that's the whole purpose of that show, then it is something that needs to be disqualified, because basically that animal is not market eligible, because it would present on the rail or at slaughter with the drug residue.
Okay. Another question we have are, what are some consequences of testing positive for a drug at a show?
Well, and that's those can be very steep and very severe. And I can tell you that basically those are left up to the show committees, and every show usually has a board or a committee, and it varies committee to committee and state to state. Obviously, I've seen where people might lose, basically forfeit their placement and forfeit any prize money and any earnings that they receive, all the way down to being banned for life from ever showing again. So I've kind of seen kind of a broad spectrum, and again, it depends on show to show, and it also probably depends a little bit on the severity of the situation and how negligent and how intentional the act was.
One other question we had, and I'm not sure if you ever get to see the results, is how often does someone someone's animal test positive for a drug?
That depends. Again, and I can't really speak too much to that, because a lot of times those are held internally. But it does happen, and some of it is just being, and that's part of why I wanted to talk tonight, because especially like on the topical medications or on medications that potentially the withdrawal's been met, but the elimination time has not been met. It happens, and sometimes people just don't realize how sensitive the drug test can be, and how how small of an amount of residue or drugs can be picked up in those tests. So it does happen occasionally, and I think that there's a I don't know if I have any stats for you. Ideally, we hope that nobody tests positive, and that's the way it works, and that's the whole goal of this. But occasionally they do. It's few and far between, but unfortunately they do.
If any of our attendees have additional questions, go ahead and put those in the chat. Okay. Well, if that wraps up our questions for the evening, I want to say thank you to Dr. Hawkins for taking time out of his evening to talk to us about this very important topic. And thank you for everyone who participated live this evening, and for those watching the recorded version at a later date. Please remember to sign up for your prepared speech times. Those are going to be Tuesday, September 21st, and Wednesday, September 22nd. So if you're watching this live, that's tomorrow and Wednesday. And if you're watching it recorded, I hope you have signed up for your prepared speech time. And then also make sure to sign up for your career development mock job interview dates. So those will be at the show, the Saturday of the show. So make sure to sign up for a time so that we have you in a time slot. And we're flexible with those. If your show schedule is running long, or you need to come early, that is totally fine too. Those are just so we have an idea of who's coming around what time during the day. So those links are all posted on the Kansas Junior Livestock website, Junior Livestock Show website, as well as in the emails that we've been sending out. Don't forget to turn in your participation survey after this session. This is the last one. If you missed any, make sure to go back and fill out those participation surveys as well, so you get your points. But if that is all of our questions for the night, I want to thank everyone and have a good rest of your evening. Thank you, everybody.